Okay, so I'd like to welcome everyone to our fifth session of the United Way is Local Love in a Global Crisis Speaker Series brought to you by the University of New Brunswick. Today we'll be discussing aging in uncertain times. Just a couple of housekeeping items. If you're not speaking, please keep your mics on mute. This video is being recorded and live streamed to Facebook. If you don't want to be part of the recording, please turn off your video. Verbal questions can be asked at the end of the session, or you can type them right in the chat box during the session, and we'll make sure to check those at the end and give those to our speakers. So I'd like to start with acknowledging the space we are in and the land we are on in this beautiful region that we live in and get to call home. We are located along the beautiful banks of the Woolstook River, the unceded and unsurrendered Mi'kmaq and Woolstook Way territory, signatories to the peace and friendship treaties, and members of the Wabanaki Confederacy. With that, I would like to recognize and welcome everyone who is on the line today, whether here on Zoom or on Facebook. Once again, today's topic, aging in uncertain times. UNB is proud to partner with the United Way to present this series, and as well partnering with other community organizations who are continuing to adapt during these times to ensure our family, friends, and neighbors continue to have access to the support they need. We'd also like to thank our sponsors of today's session, NB Power and the Forever Fund. The Forever Fund is the endowment fund of United Way of Central New Brunswick. The endowment fund was established to assist United Way in serving citizens of Central New Brunswick now and in the future. Their support help us address immediate needs and sustain long-term projects that will help children, youth, and families reach their full potential. If you want more information about the Forever Fund, you can contact one of us. And I will now pass it over to our moderator, Roxana Atkinson, who is our Director of Community Impact with United Way.
Thank you very much. So thank you everyone who is here today, and thank you for anyone who's watching the recorded video at a later date. This is fabulous that you can join us. We're so excited to be able to present these speaker series, because it really helps us to dive into topics that we're talking about and working with different partners on every day. And with COVID-19, we've really we've learned a lot, and we've had existing partners who are dealing with the urgent needs of our community members, but we're meeting more and more different community members who are making an impact in their communities. So I am so pleased to have Cheryl and Betty here today. So I'm just going to do a quick little bio, and then we're going to dive right into the questions. And if at any point you have any questions, please feel free to put them in the comments box, or if you end up having a question and you're watching the recording, please don't hesitate to send them our way, and we'd love to answer after the fact as well. Okay, so welcome Cheryl Pepin. So Cheryl has been a community developer with Horizon Health since 2013, serving the communities of Harvey and Macadam. She's a graduate of the University of New Brunswick Business Administration program and previously worked in the health and education sectors. Cheryl's work in community development looks at the social determinants of health and how they impact health and wellness in community. She helps to identify what the needs or gaps are in the community and works with community partners to come up with solutions. And so welcome, Cheryl. Now, Betty Daniels is our second speaker today. So Betty Daniels has been the executive director of Meals on Wheels for the past 5 years. Prior to that, she was the administrator at Orchard View Long-Term Care for 5 years. And prior to that, she worked in the dental field for many years, ending with a teaching position with the College of North Atlantic, Qatar, teaching dental assisting in the Middle East as well. She holds a BBA and a Master's of Applied Health Research, and is a mother and a grandmother. So welcome both Betty and Cheryl. So we're going to start with a look back at the very beginning of when COVID hit. So how did the early days of COVID-19 impact the well-being of seniors in your community? And before I begin, I would like to say, so Cheryl lives in a more rural part of our province, while Betty is here located in the Fredericton region, so a little bit more urban. So it will be really great to hear both perspectives from both of you. So again, how did COVID-19 crisis impact the well-being of seniors in your community in the early stages?
I can start, if that's okay. So as Roxana mentioned, I live in the community of Harvey, and Harvey is very rural and geographically widespread. It's probably the definition of rural New Brunswick. So we have the village of Harvey, which has about 350, 360 people living in a kind of a condensed space. But then we also have two LSDs on the border of the village with about 3,000 people living in it. And we also have a large senior population. So things like access to transportation, reliable internet service, these are things that were challenges pre-COVID. And obviously COVID just sort of intensified those issues. A lot of seniors rely on families, friends, or neighbors for things like transportation to appointments, getting their groceries or medications. So these were all issues that we were dealing with. We were also concerned about how social isolation was going to impact seniors' mental and physical wellness, how seniors were accessing their food and basic necessities, and also how they were accessing accurate, reliable information, because as we know, a lot of the information was being pushed through social media, which is great, but if you don't have access to internet or technology, that's not going to be helpful for seniors in our community.
Thank you. How about you, Betty? What did you see with your clients?
Yeah, I would actually echo a lot of what Cheryl has said. Even though we are in an urban location and transportation is not quite the same issue, I know that social isolation is, regardless of where you're living. And that perhaps has been one of the things that has become even more apparent. Meals on Wheels prepares and delivers about 225 meals every day, and the majority of our clients are seniors. From an organizational point of view, our concern was being able to continue to service our clients, which we knew was more important than ever, to ensure that we were doing it safely. But certainly some of the feedback that we were receiving was just how important the service was, and more than the food, how important that visit from the volunteer was. I think perhaps I heard more than ever before in the 5 years that I've been with Meals on Wheels, from families and from clients saying how much they appreciated the service and they appreciated the volunteer delivering the meals. But it's challenging because safety and ensuring that you have good information being pushed out, and there's no question it's very difficult to do that in this environment. But certainly some of the same challenges. I don't think the transportation challenge or the access to food for our clients was as much of a challenge, but the others were definitely challenges.
Yeah. So with that, like, what vulnerabilities were exposed around the available supports for seniors? What were you hearing?
I can go again. So I think what we realized is that not necessarily did COVID create new issues, but it definitely intensified issues that were already existing. So in Harvey, we realized because we don't have a grocery store within the community, we didn't have any existing food delivery service. These were huge gaps in the community. Everyone was isolated in their homes, and seniors, especially who may have underlying health issues, were scared to go to grocery stores. In transportation, we do have a dial-a-ride program, but because of COVID, that had to stop operating. So now we're all staying in our own household bubbles. Seniors can no longer rely on their friends and neighbors. Seniors who were living alone, like, we had no formal system in place. So who was checking on these most vulnerable people in our communities?
I would agree with that. I think it didn't create necessarily new problems, but the problems were there in terms of isolation, in terms of how difficult and lonely it can be. For Meals on Wheels, there was fear on the part of some of our volunteers, on the part of some of our clients and their families, and reassuring them and getting that information out that we were operating in a safe environment, that we could manage this. There were many challenges. The support from the community was unbelievable. And probably in my entire working life, I haven't seen anything quite as positive and inspiring as that. But just information and communication, and knowing how to let people know what you need, and how to, invite people to help, can be very challenging.
Yeah, and so that leads us to, you are seeing the vulnerabilities exposed. So then what sorts of innovations have been developed and what is still challenging?
Yeah, so in Harvey, one of the first things we did was to focus on the communication side of things, I guess. So we developed a COVID-19 awareness Facebook page, but we realized that was not going to reach everyone. So we put together a COVID-19 resource package that was mailed out to everyone living in the greater Harvey area. So it just had basic information on public health guidelines around COVID-19, what resources were available. But also as a part of that, we had a list of community helpers. So through our Facebook page, we put out a call to the community asking for people who were willing to volunteer to act as a community helper within their neighborhoods. And basically what they would do is serve as sort of a point of contact for people looking for information, but also to check in with neighbors that they knew were maybe more vulnerable. And the response to that was quite amazing. We were able to put together a really extensive list of community helpers, and that list was sent out as part of the resource package, so everyone had access to that information. Also within the resource package, we sent a sheet of red paper and a sheet of green paper. And the idea was that if you put a green sheet of paper up in your window, that meant that everything was okay in your house. But if you put a red sheet, that meant everything was not okay, and you wanted someone to check in with you. So our community helpers helped to monitor those sheets of paper in people's windows. We did have to make it clear, like, don't use the red sheet of paper if it's a situation where you should be calling 911 and that sort of thing. But just driving around the community, you could see the sheets of paper in people's windows. So we know that people were using that system, and that they really appreciate just knowing that help was there if they needed it. Another initiative we started was a grocery delivery program. Like I mentioned, we don't have a grocery store within the community of Harvey, but we were able to partner with our neighboring community of Macadam, and their grocery store was willing to take orders by phone or by email and pack those orders and put them in bins. And we have volunteers that come once a week to pick up those bins of groceries and deliver them right to people's doorsteps. And thanks to the United Way for funding that program, covers the cost of our volunteers' mileage to do that. At the peak of COVID, we probably had about 10 to 15 people using the program. It's obviously slowed down. We're still running it. We have about 3 to 5 people using it each week still. And we're going to keep that going as long as we can, because it's a really worthwhile service, I think, to the community. Another initiative we started was a free meal delivery program, because we don't have a seniors meal delivery program in the community. So again, the United Way was able to provide us with some funding to start that. We partnered with a local restaurant, Westphalia Bakery, who was willing to prepare the meals. And then the funding from United Way covered the cost of those. And so we were able to provide 1 free meal a week to over 40 seniors in the greater Harvey area. And that ran up until the end of July. But really that was a short-term solution. We wanted to start a more sustainable volunteer-led program. But we quickly realized we don't have a kitchen space in our community that would meet the requirements to start that sort of program. So we're in the process of trying to develop a Meals on Wheels type program for the Harvey area. We have obtained some funding through the emergency funding program through the United Way, and we have a number of community partners on board. But we have run into some challenges because of COVID. Some of our partners have lost some of their revenues, like the community center that hasn't been able to run to their full capacity, and Harvey Community Days wasn't able to do their full event to raise money. So we're kind of at a bit of a standstill. We're trying to find some more funders, because we want to renovate the kitchen to its full potential. We want to make sure we're bringing as much benefit to the community as we can.
It's really great. Before I pass the baton to you, Betty, I just want to say with the community helpers, that was a model that I think every single person who saw that list of community helpers was in sheer awe. You know, like I couldn't believe that, you know, I say smaller community, but it's vast, you know, in region, but like it was so wonderful to see that so many people had volunteered to say, hey, I'm willing to help if you need anything. And you know, I think I talked to every single other community developer and every person that I was in contact with saying, we need this in every single community. Like we need this in Fredericton, we need this, like that is the best point of contact, someone close to you who has the time and is willing to check in and be, you know, in so many different ways, not just groceries, but also to be a person to talk to. And I know it's difficult with COVID-19 restrictions, but it was just a model that like we keep talking about, and kudos to your community for doing that. It is just such a wonderful example of how the community gets together. So Betty, same question. What innovations have been developed and what is still challenging?
So interesting to listen to what's happening in that rural community. We represent such a small piece of Fredericton. You know, we have probably, you know, 300 Fredericton seniors that we are providing a service to. But during these challenging times, I think one of the things that became so clear to me was just the importance of the volunteers who deliver our meals and their connection with our clients. We had to move to a contactless delivery, meaning that the volunteers cannot actually go into the homes of our clients, but they leave baskets outside so they can leave the meal, step back, and every one of our volunteers just continues. They knock on the door and they continue with that dialogue, even though it's a little piece, you know, a little distance. And I think it just shows how important that piece is and how important community connection is to the clients that we have. Meals on Wheels was also asked to participate in a research project through that the city's age-friendly organization is embarking on, that's dealing with isolation. And some of our Meals on Wheels clients participated as, you know, speaking with the researcher on that, and some of the information that came to light. Again, just spoke to the importance of the, you know, for our organization of the meal, but also of the volunteer visit and just how essential that is. We have tried to up the communication to both our volunteers and to our clients. We, you know, with a summer newsletter, trying to embrace some of what was happening, trying to stay connected. And I find that our volunteers just, you know, bring stories back to us and tell us things so that we can follow up. So it's a tiny little piece of what, you know, what we're talking about here that Meals on Wheels has been able to do. We, for the past 20 years, have had once a week a Wheels to Meals luncheon program. And we had to cancel it because of COVID. But one of our employees has reached out to every one of our regular clients, and we're planning to do a Christmas event. So I think those, you know, I think you would call those innovative approaches to dealing with something that has dealt us a bit of a hand that seems to be contributing to isolation, as opposed to trying to, you know, as we're trying to address it. But the challenges remain. You know, we're one small piece of Fredericton seniors population. And I know that I think communication and how do you reach people who maybe are in need of even an organization like ours, it can be very challenging. Because as you say, social media, it is wonderful for those who embrace social media, but that's not necessarily everyone who we need to reach.
Absolutely. And I just want to add one challenge we found, because we created senior handouts for different regions, is that the information is changing so often. Like a program might be funded for a small period of time at the beginning, but if we send it out, we get worried that it might change and not be available, or a resource online, it may not be available. And then also make sure that we have the telephone numbers, not just the online links. Like it's so, everything has been moving so fast. That was a challenge we found at United Way is how to link people to the right resource that is still relevant at that moment. So it was very challenging in that way for us. So I'll move to the next question. So with an uncertain future ahead, what steps can seniors take to protect and enhance their well-being?
So I think obviously the safest thing is for seniors to be staying home right now. So, it's finding ways to help with their mental and physical well-being. Is there exercises that they can be doing at home or going for walks when it's safe to do so? Maybe finding new interests or activities that keep them occupied, but also keep your mind occupied, your brain working. Maintaining those social connections if you have them, so you have people to talk to in uncertain times. And if you don't have that, reaching out to the resources that are available. And I think having 211 implemented here is a huge opportunity. We have to make sure that seniors are aware of that, so they're accessing that resource. And seniors, ensuring that they have safe access to basic necessities like food and supplies and medications, accessing delivery services when they're available. And if not, finding a neighbor or a friend or someone who can help them so that they can stay home and stay safe.
And I would,
Yeah.
I would echo.
Go ahead, Betty.
I would echo that. And I think, if there was just a way that we could ask, if only we could ask seniors to reach out to those who, are in organizations trying to help. But it's difficult sometimes to get that information. And I think that many times it's in Meals on Wheels, it's our volunteers. So many of them are seniors. And I find that they are wonderful ambassadors to help carry information and bring information back. But I do think it's reaching out and being able to reach people and trying to communicate what is possible. And I too have hope for the 211. I think that's a great step. But I also think we need that personal involvement from community.
And thank you, Cheryl, for bringing up 211. So one thing that was really great is in October, 211 was launched. Now it's universal across every single province across Canada, and it's a United Way initiative that we are so proud to bring. So very easy, just like 811 and 911. 211 is a easy 3-digit number to remember for anyone who's looking to connect to information on the resources and supports on any topic in their life, really. It is, and within 30 seconds, all calls are answered by a real person who's ready to help and connect a person to whatever they may need, whether it's support with housing, food services, social assistance. They will help and brainstorm with the person what their needs are and connect them to the local resources that are available to them. So we're really excited about that. Thank you so much for bringing that up. So the last question of today, and if there's any questions at the end, we'll answer them as well. But what steps can the broader community take to support your agency and the health of their senior family members, friends, and neighbors?
I think I'd like to see our community continue to do a lot of the things that we have been doing with the community helpers and checking in with vulnerable neighbors, and just thinking about people around you that maybe are more vulnerable and making sure that they're okay. I also think helping to spread information by word of mouth is one of the best ways to get information out there. And I think one of the things we kind of realized is that maybe we could have used our community helpers a little more to do that, to make sure that they had all of the information so that when they are checking in on people, they can be directing them to the right resources. Another thing I've been thinking about is how we can assist seniors with access to technology. Sometimes it's just that it's too overwhelming to them. So are there things that we can be doing to help them learn more about social media so that they can access, timely information? I'm also been a part of the resiliency planning committee for my region, and this has been a point of discussion as well. We've talked about putting more computer access points within the community at places like the library or community centers or municipal offices, and deeming them essential so that people can access computers at any time. And then also the community can find ways to support people to stay at home, maybe offering different virtual activities. Like we've done bingo, we've had virtual exercise classes. You could do painting classes online. Some of our physicians have gone to virtual appointments or appointments by telephone. So just making it easier for people to stay home and stay safe.
I think in the city of Fredericton, if I could, ask, other citizens within the city, it would be just to reach out and volunteer. There are many, many organizations in Fredericton trying to provide programs, trying to assist, and just reach out and see what you can do to help. Also, financially supporting organizations who are trying to support seniors, because it is such a challenging time. And the more that a community can come together, I remember one of our volunteers, we were just interviewing and saying, what is it that makes you volunteers with us 3 days a week? And he said, I just want to be part of a caring community. And I think if we can maybe give that message that there is a need, and we do need to come together as a community and reach out and be there for those who are the most vulnerable in our communities in all kinds of different ways. And I think it's win-win, because it's the person who is volunteering or who is supporting, in the end, has great gain from that as well.
Thank you. Thank you both. Kate, are there any questions at all that have come in on the chat?
No questions, but I have a question, if the ladies don't mind. I guess we're seeing some more lockdowns in different cities and such. So I'm wondering if you guys have any, ladies, sorry, if you have any strategies kind of planned for the next couple of months while we maybe await a vaccine or what have you, kind of what your strategies or practices are for the next couple of months as we kind of weave in and out of these different stages of, lockdown, not lockdown, that kind of stuff.
Maybe I can address that one first this time. Certainly for Meals on Wheels, as one organization providing meals to seniors, from day one we have just tried to wrap our heads, if you will, around how do we safely continue to provide our service. And we just have become more and more determined as time goes on, working with the Department of Health, ensuring that we have our COVID plan, doing everything possible to keep our facility, our employees, and our volunteers safe, so that we can in turn provide the service that we provide. So I think it's trying to just follow every guideline possible and maintain that connection with the Department of Health and all the organizations that we are working with. For us, it's particularly the Department of Health in food service, but WorkSafe, everything, just trying to make sure that you're not missing any steps in trying to maintain that safety, so that you can continue to provide what you provide. There are no guarantees in this, but I can't stress enough that we've got to just embrace what is the advice that's being given to us and the guidance, and follow it.
I think for us in Harvey, a lot of the initiatives we started have continued. So we'll keep them going, like the grocery delivery service. We still have our list of community helpers who are there, ready, willing to help. We may do another mail out if we become in another red situation. Fingers crossed that doesn't happen. But I think we're in a good situation right now. We've gone through it. We know what worked, so we can continue with those strategies that kept us in a positive manner here in our community.
Perfect. Thank you.
That's great. So if anyone wants to connect with Betty or Cheryl, Betty, if you go on mealsonwheels.com, right? Or sorry, what is the exact address for the Fredericton one?
Fredericton Meals on Wheels.
Betty.
Yeah.
FrederictonMealsOnWheels.ca. And Cheryl is a community developer with Horizon Health. So you can always either contact us here at United Way and I can link you to her email, or it might be available online as well, Cheryl?
I don't know if I'm available online anywhere. Yes, you could provide my email address.
Yeah.
We do have
If anyone has
Facebook page for our Harvey Community Hospital Foundation. If anyone wanted to see the work that that organization is doing as well.
Perfect. Awesome. Thank you. So thank you both so very much for your time and for sharing this information with us today. We just value everything you're doing and we love hearing everything. And you're such important community partners to our United Way. And again, we just can't applaud your efforts more. Thank you.
Thank you.
Thank you.
Thank you all.